there's just so much.
You're listening to a Mamma Mia podcast.
I was your typical teen binge drinker, and I started probably when I was about 14 or 15 and continued that on through into my 20s until I went through one of those real toxic phases of wanting to get healthy and skinny. This was around the time that The Biggest Loser was massive on TV, and so part of that little toxic journey was also giving up alcohol, but it was incredibly difficult. Hello, welcome to Well Aussie Women. This is your full body health check. I'm Claire Murphy, and as we embark on today's episode, I should probably mention that I don't drink alcohol really anymore, which has come with some interesting responses from those around me.
And I'm Dr. Mariam, a GP who's seen just how much alcohol can sneak into people's everyday lives and how it affects our health more than we realise.
Yes, we are talking about alcohol today. Part of Aussie identity, love it or hate it, and it does have potentially one of the most extensive impacts on our country when we're talking about drug addiction and drug dependency as a whole for a lot of different reasons. So today we are going to be talking about how to identify if you have an issue with it, which is something I know myself and my friends have struggled with in the past, what it is actually doing to us and how to treat our sometimes toxic relationship with alcohol. We'll also drop into the doctor's office to discuss Nadia's ovaries and why they seem to be kicking her in the guts right now. But next, Mariam, I just wanted to ask you a question. Have you ever, and I'm presuming you have in your time at med school, but have you ever had to do CPR on a patient?
Yes, unfortunately, more times than I can count, especially when I worked in the hospital system. When I was a junior doctor, I was in a large tertiary hospital that had lots of geriatric patients. So, yes, we were doing it often and unfortunately on lots of elderly patients with multiple medical comorbidities where the chances of survival, unfortunately, were very low.
Wow.
Many of them haven't had the chance to discuss things like a do not resuscitate order or an advanced care directive with their family or GP. And that's the heartbreaking part of CPR because it's not gentle. It's physically traumatic, and for people who are frail and unwell, it generally does more harm than good. They don't generally survive it when they're quite frail and elderly and have multiple comorbidities. And that's why I always say have those tough conversations early when you're healthy and when you can make those decisions clearly. Talk to your GP, get it done.
Also, if you are in the sandwich generation, I know sometimes these conversations with your ageing parents is really tough. I've been there. I've been accused of wanting to pull the plug already. We know it's not that easy. But next in today's med school, we're going to find out why us ladies might not get CPR in an emergency.
Welcome to med school.
Did you know if you are a woman and you have a heart attack outside of a hospital setting, you are less likely to be resuscitated by a bystander? A recent Australian study did a retrospective look at nearly 4,500 cardiac arrests that happened between 2017 and 2019 and found that 71% of bystanders gave CPR to men, while only 65% did the same for women. Why is that? Because anatomically, it doesn't change how you administer CPR, whether you're a man or a woman, but it has been reported that bystanders might have a few concerns about doing it on a woman because they might be accused of sexual harassment, or if they do attempt it on a woman, they might cause more damage because there's this idea that we're frailer than men and might get hurt easier. But also, they might even struggle to recognise that a woman is even having a heart attack because, as we know, we are all so much more familiar with the symptoms and what it looks like in men than in women. It also doesn't help that 95% of CPR mannequins are flat-chested. So there is very little experience for those who've trained to be comfortable with boobs during it. So, Mariam, I'd love to get your idea because obviously you've been medically trained.
Yeah.
Did you ever have a mannequin that had boobs?
Never. Yeah, it was the flat-chested white male mannequin with the gold comb-over hair.
I love that, yeah.
And that's still the case in most training sessions today. Yeah, so a subtle example of how even something as fundamental as CPR has been designed around the male body as default. And as you mentioned, cardiac arrest, it doesn't discriminate, and steps for CPR are exactly the same, whether they're male or female. What's different, unfortunately, is the response. And we know that, yes, unfortunately, females are less likely to receive bystanders CPR. And that hesitation can be deadly. every minute without CPR reduces survival chances by about 10%.
Oh, every minute.
Yeah, and that's huge.
Yeah.
And a lot of people freeze because they're worried about causing harm or being accused of something inappropriate. But the truth is not acting is more dangerous. And you're right, another piece of the puzzle is recognition. We know that women's heart attack symptoms can be a little different to men, so it's not that classic Hollywood grab your chest. So it could be the jaw pain, shortness of breath, the nausea, or overwhelming fatigue. So unfortunately, most people don't realise until it's a little too late. So yeah, it's time we change this.
Well, next level too is, and we now have a better idea of the bystander effect on men versus women, but it doesn't take into account, say, people who are transgender or non-binary. We don't know if they're even less likely to receive CPR by a bystander if they suffer a heart attack or not. So get used to boobs. Like 50% of the population has them, and other body types too. I've witnessed someone give CPR to a colleague who had a heart attack in the office. He was a very big man. I wasn't strong enough to do it, so my male colleague stepped in and he administered CPR. As you mentioned, it is not kind. It is a very rough thing to go through, but like we need to get used to the fact that different body types might need our assistance.
Exactly. At the end of the day, CPR doesn't change based on gender or anatomy. You go center of the chest, push hard and fast and call for help. That's it. The rest is just background noise.
I remember in training you get taught to do some finger thing to find the spot.
No, not really. I just find the sternum part and then just
go for it.
1/3 of the way, the chest down. You've got to go deep and hard. Yeah.
Okay.
And you're not doing it properly until you hear a rib crack.
Oof, that's rough. Okay. It is, on that note, time to get into today's checkup. We are talking about our troubled relationship with booze.
It's time for the checkup.
Alcohol is, sadly, a really big part of the Aussie identity. We're told time and time again how Australians are a relaxed bunch, but when someone pointed out on Reddit recently how after moving down under, they were concerned that their new colleagues were constantly ending their workday in the pub, this person was slammed in the comments saying, like, they're just trying to unwind. They're inviting you to be social. Like, don't be such a whinger. But the reality is around 1 in 10 Aussies who drink struggle with an alcohol use disorder, with alcohol contributing to nearly 6,000 deaths across the country each year. It is serious. And despite that, though, we will defend our right to drink at every turn. And we've encouraged things like mummy wine culture, a few beers at the footy or the cricket, a casual bottle of wine with dinner, binging on a girls' night out. Like, that is all incredibly normal for us. It is how we socialise, how we celebrate, how we relax. And in fact, it is really hard not to drink in Australian culture. I was your typical teen binge drinker and I started probably when I was about 14 or 15 and continued that on through into my 20s until I went through one of those real toxic phases of wanting to get healthy and skinny. This was around the time that The Biggest Loser was massive on TV, and so part of that little toxic journey was also giving up alcohol, but it was incredibly difficult. Everyone said that I made them feel uncomfortable being sober when they weren't. And there was some idea that I was maybe judging them while they were drinking because they were no longer in control maybe. And I would spend my nights at the pub guzzling water by the gallon because I felt like I just had to do something with my hands while everyone around me was also drinking. And I realised I didn't really know how to be without alcohol and being social anymore. It was a really hard transition. And then I went back to drinking, but then a couple of years ago just kind of gave up by accident. And I'm not quite sure whether it's a side effect of perimenopause because your tolerance to alcohol does decrease as you get older. But also too, I've been told that weight loss injections can impact things like dependence on alcohol. I don't know what it is, but now I only really have a drink at a major event, and even then I may not. And it is a massive change to health, like to have your weekends back and to not ever feel hungover again after spending so many years in that state. It was a real difference and I've forgotten what that was like.
Yeah.
It was a real big deal. But Mariam, I'd love to know what your relationship with alcohol's been like.
I had a bit of a confusing relationship with alcohol myself. So I was raised in a culture where alcohol was strictly forbidden. We say it's haram. But then outside that environment, it was like completely opposite. So drinking was just what everyone did and it was social. It was how you connected, how you relaxed, how you belonged. And I was in med school, post-exam celebrations all revolved around alcohol. So navigating those two worlds worlds was a little confusing, but I understood why it was discouraged culturally, but also saw how central it was to social life.
I didn't consider that that for cultures who have made Australia home where alcohol is not a part of
it's hard.
life. It's difficult.
Yeah, especially when you're a kid trying to navigate both those worlds and trying to find what's acceptance for me.
Yeah.
But now as a doctor, I think I've found a much clearer perspective. I know the effects of alcohol that it can have on the brain, the liver, the hormones, even sleep and mood, which for me were massive. And while I have a glass here and there, and that's perfectly okay for most people, it's not something I personally go out of my way for anymore.
Yeah.
So I've come to see that you don't need alcohol to feel connected or confident, and that's been quite freeing as I've gotten older.
Yeah. Well, how would you help someone, and do people come in and sit down in front of you and say, hey, I think I've got a problem, or how do you encourage people to deal with drinking problems?
Generally, people don't offer it. It's something that I kind of have to ascertain somehow.
Especially because it is so normal, we don't see it as a problem, right? Because everyone does it.
That's right. But when someone comes to me to ask about their drinking, my first goal isn't to judge, it's to understand why. A lot of the time, though, it's just me generally getting a history, or so how many drinks do you have a week, or how often are you having alcohol? But when we do get to that point where alcohol might be an issue in your life, most of the time alcohol isn't the problem. It's a coping mechanism that's been developed for that person. People drink to manage stress, loneliness, trauma, anxiety. And so I start there. I'll ask about their routines, their triggers, what they actually get from drinking. And from there, we talk about harm reduction. So that might mean cutting down gradually, using medication that can help with cravings, or linking in with counselling and some support services. The key thing is recovery doesn't have to mean going cold turkey overnight. And I think that's a common misconception that a lot of people have.
For some people, that might be the way, right? But it doesn't have to be.
It doesn't have to be. It's about building a plan that feels safe and achievable.
Okay. You mentioned there you need to get a history from people.
Yeah.
I will admit I've lied many times when my GPs asked me how much I've drunk in the past.
Yep.
How do you get past that? Because I don't want to admit how much I'm drinking. I know that my friends would probably play it down a little bit, make it sound a bit less of a problem than it is. How do you get past that?
Yeah, I think almost everyone underreports their alcohol intake. And there's this big shame and stigma around drinking.
When they put it like, how many drinks do you have a week?
Yeah.
My brain can't figure it out because I might have like binge drank 2 weeks ago and had like 20.
I don't like the way that we ask the question. But look, I always tell my patients, I don't care what the number is. I care what's behind it. The more honest you are, the more we can help you safely. So sometimes I use simple open-ended questions like, what does a typical week look like for you? Rather than how many drinks do you have, because people think in patterns, not numbers.
Yeah.
And if you've ever lied to your GP about drinking, don't beat yourself up. Just start fresh next time. GPs, we're not there to judge. We've seen it all. We've been through it all. And we're there to help you figure out what's going on underneath and support you through it.
Yeah, that judgment is sometimes a lot to overcome.
Yeah.
We don't want people to think that we have a problem.
And I think a lot of people don't actually know, is alcohol a problem for me or not? So if you're in that kind of grey area, we're like, oh, I don't know if alcohol is actually harming me or I'm forming an addictive relationship with it. It's always a good place to start with your GP. Just say, hey, I want to have a chat about my relationship with alcohol. This is how much I'm having. What are your thoughts? And what can I do to have a better relationship with it?
Okay, next we're going to speak to Professor Kate Conigrave. She's an addiction specialist and she's going to break down how we even know that we have a drinking problem, what alcohol is actually doing to our bodies, and how to help someone who's become a full-blown alcoholic.
Parenting podcasts can be a bit earnest. Parenting Out Loud is not that podcast.
This person who I may not agree with politically is trying to talk about integrating children, not just into his professional life, but into public life.
I have referred to myself as one and done. That article did make me rethink the term.
It took about 11 seconds for this to go viral.
Oh God, is this the ejaculate one? That is deranged and I love it.
Parenting changes the way you see everything. Parenting Out Loud takes the big conversations of the moment and puts them through that filter.
Because if parents are thinking about it, we're talking about it.
Parenting Out Loud. Listen weekly wherever you get your podcasts.
Kate Conigrave is an addiction medicine physician and public health physician at the Royal Prince Alfred Hospital in Sydney. She is also a conjoint professor at the University of Sydney, and we wanted to know from her if that data that we've heard about alcohol being the most destructive drug in Australia was actually true. Quick note before we go, this is general information only and not medical advice. Treatment options, including prescription medicines, aren't suitable for everyone and need an individual medical assessment. So please don't start, stop, or change any medicine based on this episode. Please speak with your GP or pharmacist first. I guess the first thing we want to touch on is we've heard from experts who tell us that alcohol is actually the most physically, economically and socially damaging drug that Australians deal with. Would you say that's true?
It's a tight battle between smoking and alcohol. Tobacco probably wins overall, but if you just look at young people aged between 18 and 45, alcohol tends to win.
Well, can we talk about what some of the long-term impacts are of alcohol addiction? So people who are using quite heavily, and I'd like to get a distinction from you maybe first about the different impacts of someone who, say, binge drinks a lot in one sitting as opposed to someone who drinks frequently and of a decent volume. Are either one of those more damaging than the other?
Each causes harm. So as you know, you young people, for example, at schoolies or uni students, young apprentices, if they go out and drink heavily, they can have those short-term harms like car accidents. Even risk of self-harm goes up if you drink alcohol, and risk of assaults, getting into arguments and things escalating where they otherwise mightn't. So those short-term harms, and there's many of them, are very important. Then there's the long-term harms in those who are daily regular drinkers, particularly if they're pushing it, if they're drinking above the recommended limits and they're doing it most days, then they start to get those risks of organ damage to various different parts of their body.
Can you break it down a little bit for us? I mean, I guess the most obvious one is liver damage. Would that be the thing that someone who's a regular high-volume drinker, would that be the thing that tends to be the most impacted?
It's the most obvious one. It's the one everyone knows about. But the one that's top of my mind these days is cancer risk, because alcohol is very strongly linked to cancer risk. 7 different types of cancer, including quite common ones like breast cancer in women, bowel cancer in men and women. So that for me is right high on my radar. There's also common things like high blood pressure. Alcohol can put your blood pressure up, it can put your blood sugars up, increase your risk of diabetes. But yes, also it can damage the liver, and that can be disastrous.
What about damage to the brain? If you drink heavily for long periods of time, does it increase, say, our risk for dementia? What impact will it have on us mentally?
Certainly clinically, we see this all the time. We get people aged even in their 40s coming in with severe dementia. So they can no longer plan or organise themselves or even live on their own sometimes. And you get people in their 40s having to go into placements of supported living. So alcohol certainly in high doses can cause brain damage. And our brains are very precious, so it's one to be aware of.
Can I ask you too about the relationship between mental health and alcohol consumption? Because when we see people who struggle quite badly with mental health, say someone who might find themselves homeless, for example, we often see that there's an alcohol dependency that goes hand in hand with that. Is alcohol consumption a result of the mental illness, or is the alcohol part of the cause of the mental illness?
It's a very good question. And sometimes it's one, sometimes it's another, and sometimes it's in between. A real chicken and egg scenario. So even if you have no mental health problem, if you drink alcohol heavily, it tends to increase your rate of feeling depressed and increase your rate of feeling anxious. And it can increase your chance of feeling suicidal. So alcohol on its own can contribute to or cause those problems. But on the other hand, we also know that people who have mental health problems can tend to turn to alcohol for relief, and they get stuck in this vicious circle where they get short-term relief, but in the background it's actually making things worse. And if they can break that cycle and stop drinking with help if needed, then their mood can start to improve and they can start to move forward.
Kate, I think the thing that most of us struggle with, and I have this conversation with my girlfriends quite often, is when is drinking a problem? Because we talk about some friends might have a glass of wine each night with dinner. Some might polish off a bottle. Some might drink more regularly. Some might not drink at all. But there's always this like, I don't have a problem, right? How do you draw the line?
I think in some people's minds, it's only a problem if you're beating up your partner or getting into trouble with the police. That's the social harms. And for sure, they're disastrous, but that's setting a very high threshold for determining a problem. If you want to stay healthy, reduce your risk of cancer and all other health problems, then sticking within the recommended guidelines is the way to go. So that's for healthy adults, no more than 4 small drinks on any one day and no more than 10 across a week. These are quite small drinks.
Can we talk about those guidelines for a second? Because I've been seeing a lot of people in the healthcare space saying that maybe we shouldn't be recommending any level of alcohol to anybody. I know that socially it's such a big part of how we identify as Australians, so it's difficult to tell Australians no alcohol is the guideline. But would you say that that's what we should be aiming for, is not drinking at all?
It's also an excellent question, and I left off probably the key part of that guideline. There's no more than 4 a day on any one day, no more than 10 across a week, and the less you drink, the lower your risk of harm from alcohol. And if you look to the World Health Organization in Europe, they actually suggest no alcohol is totally safe. So it all depends what you're aiming for. If you're aiming for perfection in terms of avoiding alcohol-related harms, you'd probably go for 0. But if you want to balance the risks, just like, we balance the risks if we want to drive on the road, we know that there are some dangers, but we go in with our eyes open, we stick to the speed limit. So it's analogous to that. If you stick to the limits, you've got a much less risk of harm. And if you want to be a bit more cautious, if you've got family history of people with alcohol problems, or if you've got a family history of diabetes, you might want to reduce those limits a little bit, or family history of cancer, you might want to reduce those limits a bit.
Is detoxing from alcohol as bad as what the movies and TV shows show it as? Because it looks awful, sweating, diarrhea, vomiting. There's a lot of symptoms that we're shown go hand in hand with alcohol detox. How accurate are those portrayals?
When you're saying detox, in this case, we're talking about withdrawal, management of withdrawal symptoms or living through a withdrawal syndrome. Whereas some people use the word detox like, I'm going to have a month off chocolate, so I'm going to detox from chocolate. So if you're not hooked on alcohol, it's usually not that hard. It's just a matter of breaking the habit and the routine. But if you're physically dependent on alcohol, withdrawal can be severe. In a severe case, withdrawal can be life-threatening, and people need to go into hospital in those severe cases and have it managed with treatment to keep them safe. So there's everything from no withdrawal if you're not dependent, through a mild withdrawal where you get a little bit of shakes, you can't sleep, you feel a bit anxious. That's your mild withdrawal. Your moderate withdrawal is a bit, as you say, shakes, sweats, tremor, and then a severe withdrawal, which sometimes we know as delirium tremens, then they're really at major risk because they're losing fluids, vomiting from bowel motions, their heart's going 1,000,000 miles an hour, their temperature's up, their blood pressure's up, and it can become a very dangerous syndrome if it's not treated.
Are there drugs, like we see, say someone who has an issue with heroin might use methadone, are there drugs that now are in play that might help someone with alcohol addiction?
Absolutely. There are now 2 medications approved on our pharmaceutical benefits services. So that means they're subsidised by the government because of the evidence that they can help. And each of them in randomised controlled trials have been shown to be able to help people if they're dependent on alcohol. There's also a number of other medications being researched which show promise in helping, and watch this spot for further news on those.
So those ones that are currently on the PBS, what are they actually doing when they're helping us stay dry? Does it make consuming alcohol less tolerable? How does it work?
No, the 2 that are on the PBS, they don't make you unwell when you drink alcohol. It just slightly reduces that feel-good effect of alcohol. People drink alcohol often because they like the taste, but often they like that relaxation, that dopamine hit. In fact, alcohol works indirectly on your opioid receptors, the same receptors that heroin works on, and it blocks that part of alcohol's effect. So you feel slightly less euphoric, say, when you drink, and it just makes it easier to say, well, I didn't really want to go there, and I'm not going to drink as much. So that one can be a good option. For every medicine, your doctor checks if it works for you, if it's safe for you. The other one just slightly reduces the craving. When a person's dependent on alcohol, their brain adapts to alcohol being there, and the balance of your natural uppers and your natural downers changes if you're a dependent drinker. Because if you drink enough of it, alcohol makes you sleepy. It puts you under the table. If you drink all at once a stack of alcohol, you can go unconscious. And your brain, over time, adapts to alcohol being there by increasing your natural uppers to keep you awake despite your drinking. And when you stop drinking, you get that short-term withdrawal, which is very tough. But then, for another month or even up to 12 months, you can have some lingering after effects where you don't feel quite right.
How do you deal with alcohol addiction when it's such a big part of how we socialise and even part of our national identity in a way, like the way that Australians see themselves as fun, larrikin people who like to have a drink? How do you combat the social side of alcohol addiction?
I suppose one is to be aware that there are a good 20 to 30% of adults in Australia who don't drink alcohol. So sometimes I think we talk ourselves into the fact that everyone's a heavy drinker. And then there is another percentage of Australians that drink within those recommended limits. So I think being aware not everyone wants to drink heavily and not everyone drinks at all, and not pushing other people into drinking. Being aware of that social pressure, making sure that you've always got a non-alcoholic choice that's just as interesting as the alcoholic choice if you're the host, and supporting people if they don't want to drink. And as we know, also women who are wanting to get pregnant or pregnant, they shouldn't drink, or people who are breastfeeding shouldn't drink. So if we can make an environment that's supportive of people that don't want to drink, and we try and not make all our entertainment, all our presents, all our celebrations, all our commiserations, try and make not everything has to hinge around alcohol, I think that can help.
Kate, what is it about us that makes some of us addicts when it comes to alcohol and others don't seem to be affected by it in the same way? Some people feel like they fall into it easier than others. Is there something about our brain chemical makeup? I know you said that it does work on receptors like heroin does. Like, is it just the way our chemical soup mix in our brain is?
I think you're probably onto it in some shape or form. We're all made slightly differently, and alcohol affects our different brains a bit differently. So if you're someone who they drink a bit of alcohol and they feel very sleepy and they can't get a word out straight, you don't feel that tempted to go for your second or third or fourth string. Whereas if you're someone who drinks alcohol and you get the high but you don't get impaired as readily, you keep your balance, you keep your coordination. Some studies show that can put you at more risk. Your reward system can be wired differently. They say some people can get less buzz out of the day-to-day, your sunsets and your things, and sometimes they're seeking a bigger hit on their reward system. That can put you at risk. But also the one type of personality factor that's shown up as putting people at risk is a risk-taking personality. If you're the person that likes pushing the boundaries a bit, taking a few risks, you also can be a little bit more at risk of alcohol or drug problems. But in reality, there are many, many different genes that code different parts of our biochemistry and our behaviour that influence your risk. But if you know in your family there's a long string of people who've had alcohol problems, you'd want to take special care.
Mariam, it's so true that when we hear about drugs being destructive, we always think about meth addiction or opioid abuse. Like, that's in our brains who we think destructive addictions look like. But alcohol has been and continues to be the most impactful drug abuse issue we have here in Australia, and whether that comes in the form of injury, and we see this ramp up around Christmas and New Year's in particular. Emergency departments are absolutely crammed with people who hurt themselves from drinking too much, or through things like domestic violence, which we know alcohol plays such a huge role in. Alcohol is a really dangerous thing, but socially acceptable and legal. So we're always going to have that struggle to try and figure out how we are responsible when it comes to drinking. And we've seen what happens in some communities who do try to ban it. It ends up being made in someone's bathtub or gets smuggled in. It goes black market and becomes a criminal venture, or it ends up killing people, as we've seen happen around the world, who can potentially get ethanol poisoning from it. Mariam, what are your thoughts on our relationship with alcohol here in Australia?
I think it's a big form of dependence because of its accessibility, and it's kind of linked to that need for social interaction and acceptance.
We've talked about this off air, but you saw our relationship even change again during the pandemic too, which is something that we haven't really thought about, right?
Yeah. I think during COVID and after COVID, I saw many females come in and interesting, they would say, I think I have an alcohol dependence problem, which I'd never seen before. Usually that's information I'm seeking from them. And they'd be asking for help because they were at home, they were working, they had their kids being homeschooled, and it was just so much responsibility and so much pressure. And you've got this drug that's easily accessible that you can get sent to the house, and all of a sudden...
That's the thing, we were getting them home delivered.
Yeah, and so it's just this way to cope and get through, but then you don't realise that your brain chemistry is changing and those addiction pathways are opening up, and then you've kind of formed a relationship with alcohol and you've become quite dependent on it. But a lot of females, unfortunately, did end up with alcohol dependence during that pandemic. But I'm really proud of the ones that were able to seek that help and get that help that they needed.
Yeah. So make sure you go speak to your GP if you do have an inkling that maybe you're a little bit more dependent on it than you should be. All right, we're off to the doctors next. We're going to answer a question from Nadia, whose ovaries are, how should we say, a little angry. Okay, let's get this consultation underway. Mariam, invite please.
The doctor will see you now just through here to consult room 1.
Thanks for waiting. How can I help you?
Mariam, can you tell what ovary is doing its thing each month? Someone I spoke to about this was like, surely not, but I can feel this little pinch.
Yep.
And it will come from the left side or the right side. Like someone's just reached into my internal organs and done a little pinch, and I'm like, oh, I've just ovulated.
Yeah, the answer is for some people, yes. So the mid-cycle twinge that you get is called Mittelsmärch. It's German for middle pain, and it happens when an egg is released, and you might feel it on the left or the right. But ovaries don't always take polite turns, so you can ovulate a few months on the right side and then might go to the left. But the right is found to be a little bit more dominant than the left. The pain isn't always exact. It can radiate. So what feels like the left might actually be the right and it might just be right radiation. Yeah. And the only way to be certain is with an ultrasound. Transvaginally, of course.
That's the one, yes.
Yeah. I've had so many of them. I'm happy I'm at that stage. They can do the scan of the belly now. Yeah, so that pinch can be your ovary at work, yeah.
It's interesting because I had never seen footage of ovulation before.
How cool is it?
It's so cool. But I had this vision of like an egg just creates and then it kind of like just floats off into the...
Oh, it's not that
like
beautiful.
It's not lovely like that. It's like an explosion. It's like it's being shot out of a cannon.
It's like a pimple pop.
It is like a pimple popping. It's like this little round thing and then like the egg just shoots out over to the fallopian tube. It's violent.
Yeah, it is.
But it does what it's supposed to do. But the reason we're talking about this is because Nadia sent in a question, but hers maybe a little bit more violent than some. So this is what she wrote.
Hi, I just want to know what reasons there could be for my ovulation pain to be so intense. Sometimes it's so bad I can hardly walk. Before I was pregnant, one time it was so painful my doctor sent me to the emergency department because he thought my appendix had burst, but it turns out I was just ovulating. And now I've had twins and my pain's back. It's so severe. It's really debilitating. I just want to know if this is normal.
Okay, so if you've ever had ovulation pain, you know it can range from a little twinge right through to the kind of pain that makes you double over. But for some women, it passes quickly, but for others, it's severe and it can get mistaken for other conditions like appendicitis. That is not normal, okay? Why does it happen and why can it change after pregnancy? So we know glorious pregnancy, it can change the way our pelvis feels pain. So carrying twins, being there, done that, for example, can stretch and shift the position of the ovaries. So sometimes scar tissue, also called adhesions, can form after pregnancy or C-sections, and this can make ovulation pain more intense.
Right.
Secondly, hormones. We know that after pregnancy, your cycle may not return exactly as it was before. The balance of estrogen, progesterone, and other hormones can shift and make ovulation more noticeable as well. And thirdly, it's not always just about the egg being released. There might be conditions like ovarian cysts or endometriosis that can flare up around the time of ovulation, which can make the pain much worse. And we also know that the pelvic floor muscles and nerves can become more sensitive after delivery and pregnancy. This can mean pain signals might feel more stronger than they were previously. So is it normal, mild ovulation pain? Yes. very common, but pain so severe that you're going to the emergency department, no, that's not normal, and that deserves a proper checkup. I would start with a review with your GP, get an ultrasound to check for structural things like ovarian cysts or other changes. And if endometriosis is on the cards, maybe a referral to a gynecologist might be worth considering to help you explore that further. And for management, there are options from pain relief and heat packs through to hormonal treatments that can actually suppress ovulation and prevent the pain from happening in the first place, if that's what it is. Our big takeaway here is you're not weak and you're not imagining it. If the pain is that debilitating, you should definitely see your doctor and consider that gynae referral.
All right, Nadia, I hope that was helpful information and good luck with getting that dealt with, because that sounds like that is really, really rough.
Geez, having twins and then monthly
ovulation violence. It is not nice.
It's not fun having a vagina, is it?
Sometimes it's great. Sometimes it's not so great. Amazing advice again. Thank you very much, Dr. Mariam. But here is your warning. Every time. This is only general information, so don't take it as gospel. It's more like adjacent to you. So take it to your doctor and then you can get all the advice that aligns with your very own needs. If this topic has raised some concerns for you, please reach out to your GP or call the National Alcohol and Other Drug Hotline on 1800 250 015. Next week, we're moving on from alcohol and into other drugs, and we don't just mean things like methamphetamines or cocaine. We're talking about nicotine, cannabis, and even ones you get on prescription too, because they can lead you down dangerous paths as well. So we'll catch you for your appointment again this time next week.
Bye-bye.
Well is produced by me, Claire Murphy, and our senior producer, Sally Best, with audio production by Scott Stronach, video production by Julian Rosario, and social production by Ellie Moore. Mamma Mia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wanneroo people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.